Hello everybody, I'm Dr. Senthil Kamalasekaran, Senior Consultant Orthopaedic Surgeon at Lotus Speciality Clinic, and today I'm going to talk about the conservative management of low backache and its prevention as part of the Common Orthopedic Problem series. Low backache is one of the most common problems affecting our society. It is one of the most common reasons for absenteeism. It can affect all age groups. In the younger age group, it is most commonly affecting them because of athletics, sports, going to the gym, improper techniques, and in the working age, it can be because of sitting for prolonged periods of time, a sedentary lifestyle, and in the elderly, the pain can be due to a repetitive movement in the back causing a dull ache. In the younger population, the pain is more often like a catch or a spasm due to lifting an abnormal load. Treatment for this condition is usually giving the person rest, avoiding the causative reason for the pain, like if he has been going to the gym, to stop gym for some time, or if he's starting gym, to start with less weights and slowly move on to heavy weights. If he is actually at work, make sure that his posture is right, sitting up erect, no slouching, and always keeping your monitor at the level of your eyes, keeping your feet planted on the ground. But however, if you are very short, make sure that you have a footstool. If this avoiding of activity does not help you with alleviating your back pain, we give you tablets, and in those cases where medication does not help, we put you on a course of physiotherapy where we offer you interferential therapy, shortwave diathermy, or ultrasound therapy for the back. Along with this, we also put you on a program of core strengthening exercises for the back, in which we actually ask you to strengthen your abdominal muscles and the muscles of the back. By doing this, your core strength is improved and it can prevent you from getting any type of backache. In those cases where physiotherapy also does not help, we can provide you non-surgical options like injections, where we give an epidural steroid in the caudal epidural space, and that normally goes to all the nerve roots and alleviates the pain in the low back. For facet problems in the elderly, we have facet joint injections. And for people with discogenic pain, that is because of radiating pain going down the legs like sciatica, we do nerve root injections or nerve root blocks. The take-home message is, to prevent backache, you need to have a proper posture, sit erect, have adequate rest, do exercises, and last but not the least, make sure you take adequate breaks during a prolonged shift. Many thanks.